What is retinol?
It's a form of vitamin A that triggers cell turnover. So when that happens, it means that your skin is going to start shedding. As we get older, let's say you're a baby, your skin changes like about every 2 weeks. That's why when you're a baby, your skin was flawless. You had poreless skin. Your skin was like perfect when you were a kid. Before you hit 20, your skin sheds every 21 days. But as you get older, that doubles. So after 20, it's like 28 days, then maybe 30 days, maybe 36 days. Maybe that's why when you get older, your skin starts looking dull. That's why you have to start using a retinol to help shed that extra layer of dead skin that's been building up. And that way it reveals the brighter skin that's underneath.
How do you use retinols effectively?
Always use it at night. You have to test it out. It takes about like a month for you to notice a difference. I would try it once a week first before you build up to twice a week or 3 times a week. If you do it every day, I think it's a little too much. Try it once a week. If you tend to feel like there's nothing going on, then you up it twice a week, because you're gonna have to have like a point where your skin has to shed. It's gonna help shed your skin.
Why do I have to stop my retinols before getting a laser treatment done?
Because it will make the laser think that it's gonna irritate it. Like it's gonna aggravate your skin. It's gonna make it seem like, you know how sunblock protects your skin? So what retinol does is kind of like stripping away the protection when it forces your skin to shed. So when that happens, that retinol is gonna make it easier to affect your skin, like from the laser. Like you can easily get a burn from that or an adverse reaction from that. If you were like literally didn't say anything and said, we asked you and you denied that you used a retinol and you did use a retinol, you can get a burn from there.